All right, President Trump announced the emergency use authorization for convalescent plasma to treat COVID-19 after he'd been touting a coronavirus breakthrough over the weekend. Here to discuss the details is Yahoo Finance medical contributor and Columbia University Associate Professor of Emergency Medicine, Dr. Dara Kass. Dr. Kass, good to see you. So two words certainly blowing up Twitter this Monday morning, convalescent plasma. Is it a breakthrough?
So it's convalescent plasma, Brian,
Okay.
which is totally fine.
Help me
And
out,
it's
because
basically,
we don't talk like with this language very often.
and funny, convalescent plasma has been around for a long time. It's been used for lots of different infections. It's basically the idea that you can take the antibodies somebody produces naturally by being exposed and recovered from a virus or an infection, and then actually purify them and basically give them to somebody else to use as a passive immunity, putting them into those purified antibodies into their body and then letting them fight off the infection from inside. The use of convalescent plasma for infections has been around for 100 years. So no, there's no breakthrough here. In fact, there's no breakthrough even with convalescent plasma being used for the coronavirus. The data that is being used by the FDA to put this EUA through is not strong and really has been manipulated, we think, a little bit just to prove a benefit that actually isn't even between people that didn't get plasma, but really between people that got it at before 3 days and got it at after 3 days. So that even the mortality benefit they were talking about yesterday in the press conference brings up some questions about really just where they got that information from and why it meant that there was a huge breakthrough yesterday when in fact nothing really had changed.
Dr. Ines here. What do you make of this report from the Financial Times about AstraZeneca and the Trump administration wanting to fast track the use of their vaccine, the COVID-19 vaccine here in the US? Do you think that this is possible before the elections?
So I think anything is possible. And in fact, that is actually what a lot of us are concerned about with this particular EUA for the plasma. It's not actually, plasma is safe. And every study that's been done has been shown that it's safe. The concerns about the plasma EUA are that it may decrease utility or research and other consequences of using it without the same restrictions or even the same monitoring that we would use it for. But the bigger concern, the other concern, is that if the administration is interested in bullying the FDA to pass an EUA for the plasma, what would they do for a vaccine? And I think that the fact that that news came out less than 12 hours from the EUA for the plasma that there may actually be movement towards a vaccine to do the same thing is concerning. Vaccine development never has been done this fast. We've been seeing promising data for a lot of vaccine candidates through the science, through the phase 1 and phase 2 trials. But the idea that we could do what Russia has done, right, which is to skip the phase 3 trials and just putting into human arms under the idea that that's a benefit either politically or personally to anybody is actually very concerning to us.
Doctor, Joe Biden making some headlines this morning. First interview, he said if scientists told him he would have to, or he may want to shut down the economy again, he would do it. Is there anything in the data you're seeing right now that a shutdown in the fall might be in the offing or warranted?
So I think what Vice President Biden said is that he would listen to the scientists. And so if they said something, he would listen to that. And I think that the idea of a national shutdown is really a response to the idea that the virus has been really unrestricted in many American cities that haven't really acted for their own city to shut things down. There are lots of cities that the virus is doing well, and that, for example, in New York, shutting down New York would probably be overkill, and we would only do it as a national strategy to be aligned with other cities. I think that what we're looking at is that the virus does need to be addressed to get the economy back and going. And without addressing the virus, we can do a lot of Band-Aid measures towards the economy. But I think what the vice president was saying most specifically was we get nowhere if we don't have a national strategy, either in shutting things down and resetting our viral response, or in, having some sort of other response like testing and tracing that somehow would get us to know where the virus is nationally.
What do you see so far of these back to school plans now that some are all online, some are hybrid? Do you expect that hybrid model in particular to really be able to sustain itself throughout the fall if we're seeing more cases or if kids start getting these cases of COVID in schools?
So remember that the hybrid model is not about the virus as much as it is about the density of the children in the classroom, right? The only thing the hybrid model allows us to do is have fewer kids in a classroom at any given time. So if a school has the space to have 8 or 10 kids per classroom, there's no reason for them to be hybrid. The bigger concern for parents, I think, and more importantly for the medical community, is when you have an exposure or an infection, how does the school respond? Can they get children tested? Can they get staff tested? Can they go remote for a short period of time to get the virus under control and the spread under control? And then can they get back into the classroom? As we go into the fall and the winter, when we have other viruses, specifically the flu virus, we're going to need to know whether children are infected with either the coronavirus or the flu virus or another virus. There are hundreds of viruses that children get over the school year. So I think that the strategy for schools is going to be in testing and tracking much more than the hybrid model of how often they're in school or what days they're there, but really what happens after they get exposed or infected.
Doctor, before we let you go, a potential national mask mandate, how would that impact some of the data we are seeing on COVID?
So I think that the national mask mandate is a no-brainer, and I say that with the confidence of watching it happen here in New York. There is no reason to not wear a mask. And there is no reason not to have a national mask mandate. It is a good idea. Every city that has seen a drop in virus has done it simply with masks alone. So a national mask mandate is we're months behind the idea of it happening, and I look forward to the day that we have it.
All right, I'm just reading my notes here. It's convalescent plasma, and it's Dr. Dara Cass. Thank you so much, Dr. Cass.
We're ready to go next week already. Yeah.
Hey, I'm all about prepping.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.